and I think of late Uteshiya has introduced its rib fixation devices, and which are very contoured well for the anterior and posterior fixation. Hi, I'm Dr. Rajesh Deshmukh, and I'm working as consultant in cardiothoracic surgery in Kamineni Hospitals in Hyderabad. Our center, as you know, that has always been a major referral center for cardiac and also thoracic traumas, and we get a good number of referrals for thoracic traumas, which has been of late a great deal to manage. And although it's a multi-specialty involved, but then primarily the thoracic trauma requires a conservative management, as previously used to be that mode of treatment, particularly for the rib fractures. And but however, the things have changed, the indications have changed, and we try to manage the rib fractures with a surgical process if there is an indication. Previously, the rib fractures were meant to be conserved and not to be operated, and the mode of treatment used to be splinting the chest. But then patient used to have post-discharge pneumonia and atelectasis of the lungs, because there is severe pain associated and guarding. And in this reason, with the consultation and also with the indications, we do fix the ribs, and the indications being that if there is flail chest, where the segment of the chest, as shown in the picture here, the segment of the chest which is fractured moves against the respiration, so that decreases the lung work, and along with that the patient has pain and guarding, in view of which that he may end up being ventilated on the ventilator. And also, if there is severe trauma and multiple rib fractures where patient is not able to take normal breaths, and also in patients where we explore for being a hemothorax, and we're not able to maintain the hemodynamic stability, in those cases, as we have already, we are exploring it, so we tend to fix the ribs. And I think monthly we do around 4 to 5 cases in our center, and with the good results. And I think of late Uteshiya has introduced its rib fixation devices, and which are very contoured well for the anterior and posterior fixation. So the most of the time, the previous ones we used to find the difficulty was the contouring. They don't tend to contour along the rib. So when you actually fix the ribs, and later when you see the post-operators, you'll see that 1 or 2 screws would just give away, and that is to be because of the contour. And with the current device what we have, I think we are having a fairly good amount of results. They're biocompatible, and post-rib fixation, most of the patients, the hospital stay is very less. They get discharged at a very early date, and more importantly, they don't tend to have atelectasis of the lungs, and particularly younger patients where the muscle mass is too much and the pain is too or non-bearable for the patients when the rib fracture segments move against them. And I think the system has shown excellent results in these patients. I think if indicated, rib fixation does help the patients, and with early mobilization of the patients and less hospital stay, I think most of the patients will be comfortable for that. Yeah, thank you.